The Unfiltered by Jade.
Jade.
Welcome to The Unfiltered by Jade, where we get out of the box and dive into topics that are sidelined. I look forward to entertain, educate, and inspire. Feel free to like, share, subscribe, donate, and make everybody know about this.
Beats by RB Records.
Shopping assistance, your style, your budget. Our services include online and local shopping for individuals and businesses, personal shopping, purchasing of company and office supplies, importing and exporting small packages across Jamaica and worldwide, and helping you find unique gifts and items for all events and occasions. Contact us at 876-919-5195 or shoppingassistance2015@gmail.com. Shopping Assistance, your style, your budget. Welcome back to The Unfiltered by Jade. Today we have with us here a special guest. His name is Dr. Peter Kowey. So today we're going to be speaking about Failure to Treat, which is his book. And Dr. Peter Kowey, he is a William Wyckoff Smith Chair in Cardiovascular Research at the Lincoln Institute for Medical Research. He's a professor of medicine and clinical pharmacology at Thomas Jefferson University in Philadelphia. And he's an author. So I want to welcome you to the Unfiltered by Jade podcast, Dr. Kowey.
Nice to be here, Jade. Thank you. And
I want to jump into it. I want to know. So we took some chapters from the book. So we're going to be speaking about just some chapters so people can have an understanding of what the book is about, right? So we're going to jump into it in terms of the first chapter that we're going to look at, and that's medical insurance. Companies do not care about you. Can you tell us a little bit more about that?
I guess it's really hard to find anybody who hasn't been frustrated with trying to get medical care paid for. It's a very arcane system that we have, and the cornerstone of this, of course, is these medical insurance companies that are quote unquote nonprofits that make a tremendous amount of money by insuring people and not necessarily giving them the best service. For just an example of that, Jade, is about 14% of things that doctors order in the United States are denied by medical insurance companies. So your doctor thinks you need to have a test or a drug or something done, and the insurance company disagrees and will not pay for it. That's just one example. There's lots of others where insurance companies have tried to limit access to drugs or to surgical procedures. In the book, as you'll recall, the squawk in the book was about a woman who had an unusual heart rhythm problem and needed a medication for it and wasn't able to access that medication through the insurance company and ended up being harmed by having a procedure that she otherwise wouldn't have had. So we are all reasonably disturbed and upset about the fact that we rely on insurance companies to pay for medical care when in reality the insurance companies are really trying to drive a profit and not necessarily in the patient's best interest.
That's sad though.
Yeah, it is sad, and it's unfortunate that these companies are not more regulated. They really kind of work on their own. They have a very, very strong lobby, and that lobby has kept our legislators in Washington and in the states from enacting legislation that would put these people under some kind of control. But they're not controlled, and they get to do what they want. And I guess really the latest example of what you've seen in press is the Medicare Advantage nonsense that's been going on. So people who have Medicare can designate an insurance company to get their Medicare money, and then the companies that get their money turn around and tell them that they're not going to pay for things that the patients are entitled to. And that's a very, very big problem that we have with the elderly who are trying to access care for things that they really need.
Yeah, yeah. I'm saddened. I'm saddened by this fact. Because these are companies that were, and in my mind, they were brought about to care for people and help persons who need some cushioning in terms of getting their medication or getting procedures done. These were companies that I'm thinking of were instituted to help to provide that cushion for people, and that's not what they're doing. It's causing more harm than not.
Well, they are paying for things, but the premiums for the policies that people buy now are so outrageously expensive,
Yes.
and the deductibles that are built into these policies, it's not uncommon for people to have a $5,000 deductible. Think about that.
Oof, that's
They
a
have to
lot.
pay $5,000 out of pocket before their insurance will kick in for any of the care that they get.
That doesn't
Also,
make sense though. How many persons have that $5,000 to be upfront for anything?
absolutely. So one of the big problems we have in this country is not only do we have a lot of people who are uninsured, but we have a large number of people who are underinsured. That is, their insurance is not adequate to pay for the things that they really need unless they pay a large amount of money out of pocket. And it's just not a tenable thing for most people who have common conditions. They just don't have that kind of money.
That's a lot.
The other thing that really irritates me, and, the book that I wrote really is an attempt to make the public aware of many of the ills that we have with the medical care system. But, I'm a sports fan, so I like to watch sports on television. And it's amazing to me how insurance companies have enough money to put insignia on the ice of hockey games, to name stadiums after the insurance companies, to spend enormous amounts of money to get endorsements and for commercials on television, but are not paying for basic care for large segments of our population. Again, this is a lack of regulation. It's a lack of accountability.
Yes. I'm gonna agree with you on that one. It is a large part of lack of accountability on their part, and I don't think enough persons are holding them accountable for it. So if it is that they're not being held accountable for what they're doing, they're gonna just continue on the path that they are.
Of course. Capitalism is capitalism, right? I mean, it's not a really good system for medical care, but capitalism is the way that people in this country operate. And it's expected that a company that is providing insurance, whether it's medical insurance or car insurance or home insurance, they expect to turn a profit. Unfortunately, although again, they call themselves nonprofits, these very large insurance companies are making enormous amounts of money and putting them into offshore accounts in different places around the billions of dollars that they say they need for their reserves, but in reality is just money that is accruing and paying large salaries and large benefits for the people who work for the company.
Hard to watch.
Yeah, my book is hard to read. I've had a lot of people tell me that they can't read more. Remember, my book is a series of 20 stories about people who have been.
Yeah, I was reading some of the stories, and it's really hard to read though, because
Yes.
you
Yes.
leave being angry.
Yes.
Yeah.
I've had people tell me they can read one at a time because they get so angry and so upset.
Okay.
I have to put the book down and then they'll come back to it later and read another story. But it does cause people to be angry and upset. I'm not out for making people feel bad, but I think people need to understand what we're dealing with. And one of the problems that we have with the entire medical care system is that people are very unhappy with it. People are very unhappy with healthcare, but they don't know why things are happening. They don't understand the root causes of many of the problems that we have. And so the book was an attempt to explain that to people. And then in addition to that, as you'll remember, there's a section at the end of each of the stories that makes some suggestions about how we might be able to improve the system. So
Right.
It's not all negative. It's not all, beating our chests. It also is, well, logically, what could we do to improve the system to make care better for everybody?
Yeah. The way how you started off that one though, it's triggering. The way how the book starts off is really triggering in terms of that. Because with that such an important aspect that you started off with, like the stories that followed it was like, oof, it's a lot to take in. I want us to talk about story 5, which is the electronic medical record.
Well, that's Jade. It's another example of people having good intentions. So the intention when the electronic medical record became available, the intention was that, well, this is really great because it'll save time for doctors. It'll unify medical records so that they'll be more accessible. Patients will be able to access their medical records more easily, and it's just going to be a wonderful thing. And the problem is that the electronic medical record wasn't created so much to improve patient care as to improve billing and many of the business aspects of medicine, so that hospitals and healthcare systems would better be able to bill insurance companies for the things that they're doing. And because of that, there's a very heavy burden of documentation in the electronic medical record. So if you look at the record, what you'll see is there's clinical information in there that's many times very garbled and difficult to interpret, but embedded in the information things like coding and diagnoses that are really the whole thing really structured to make sure that billing can happen and hospitals can get paid. It's made it very difficult for healthcare professionals because of the amount of time they've needed to spend on these electronic medical records. They've also made it very difficult for patients because of the complexity of the records themselves. So it was a well-intentioned idea, but unfortunately it turned into something that was less than optimal.
And when recently, when they had changed over in terms of the systems that they were using for the medical records, it created a lot of confusion. People were not able to access it, and there was some difficulty in that, where still to this day, some people don't have access to their medical records to see what's happening.
Yeah, it's really difficult. One of the things that people don't understand is that older people are not necessarily computer savvy.
Right.
So an elderly person trying to navigate their way through an electronic medical record it's almost comical, because they simply don't have the capability of understanding that. One of the things, Jade, that happened when we were in the pandemic was we did a lot more telemedicine because people couldn't come into the office. And the insurance companies decided that they weren't going to pay. This is true, okay? It's hard to believe this, but they weren't going to pay for visits with the elderly unless they had some kind of a video. They said the phone isn't good enough. We need to have face to face in order to pay for the visits. Do you know how hard it was? Remember, this is like 5 to 6 years ago when people weren't used to using things like Zoom. Do you know how hard it was to get an 85-year-old elderly woman living by herself on a screen? I mean, it was. I could talk to her on the phone, but to get her to use Zoom or Teams or whatever was impossible. It was impossible. And unless if I didn't do that, this company wouldn't pay for it. The technology that we have is terrific, but it is so far advanced in many cases that people simply are not able to use it to their advantage. And the other problem that we have in Pennsylvania is that patients are entitled to see their medical records electronically immediately after they have a test. Right. So we have situations where people get a chest x-ray, and the chest x-ray comes back and says something about there being a tumor in the chest. The patient gets that information before the doctor has a chance to see it and filter it and explain to the patient what the problem is and what is going to be done about it. It just lights the patients up. It makes them so stressed out and so crazy that they can't deal with it.
Sure does.
Yeah. So it's theoretically a really good idea for people to be able to access their medical records. But what the legislators and the people who put these things into place were not informed about is there's a lot of potential for harm if you do it in a way that is not patient friendly.
True. I've had instances of that too, where I've received my result and I almost went into panic because I couldn't understand what it meant. So what I've done, and not many persons do it too, but what I have done is I've seen that, okay, the test result is in, but I wait to see my doctor made the notation or the explanation before I decide to look at it and make my own assumptions. But not many persons are going to do it because they're going to see it and then they're going to go off what they're seeing, and then it's going to go down a rabbit hole from there. Yep. So these things are somehow not thought of also when they're implementing this system. It's a great system. I think it's a great system, but not everyone is at the advanced stage of utilizing it to the best. And yeah. There are certain things that aren't thought of, just like what we're talking about in terms of even the systems and results. I think those things should be sent to the doctors first and then filtered to patients after, so that we can have a more thought of, or there can be better explanation done for test results, etc.
Yeah, Jade, well said. I agree. You remember from the story from the book, by the way, was about a woman who had an aneurysm, and she came into a hospital. She told the triage nurse that she had an aneurysm. The triage nurse wrote in her chart, in her electronic medical record, she wrote in that she had an abdominal aneurysm, an aneurysm in her belly, basically. Well, that's not what she had. She had an aneurysm in her chest. And that note got cut and pasted into everybody's note for the duration of that woman's hospitalization.
Yeah.
And because of that, nobody worked her up for the aneurysm that was in her chest. And she was discharged without any consideration of that aneurysm. And 2 days later, it burst and she died. Remember, the stories in my book, although anonymized, are all true. That's a true story. That actually happened because people use the electronic medical record in a way to try to make their lives easier. It's much easier to cut and paste somebody else's note than actually asking the patient the question and writing your own note. And that's what happens many times with that record. And it's one of the evils of the EMR.
Yeah. That's hard to digest. Physician burnout is real and really bad for everyone. Can you talk to us about that?
Yeah, that one was one that some of the stories really pertain more to patients and some of them pertain a little more to healthcare providers, but that one was the healthcare provider one. And I don't think people understand how much pressure healthcare providers are under these days. There's so many things are making their lives very, very difficult. Just to give you an example, last week, I got an email from the place where I work, and they said I had to do approximately 14 hours of computer-based training in order to maintain my certification and staff privileges.
Mercy.
So I went back and looked at what it was, and what it was is the same stuff I did last year, but I had to do it again in order to maintain my staff privileges. And so I asked the person who had sent me, and I said, we're really working really hard here. Do we really have to do this all over again? Yeah, you got to do it. It's because we have to, maintain our certification and all this other stuff. People are not thinking through how we can begin to take some of the burden off of physicians and other healthcare providers. The amount of time that's spent on the electronic medical record, on certifications, on getting our recertification for our boards. Those come up every decade. We have to completely recertify for any board certifications that we have. We have to do continuing medical education credits in order to maintain our licensure. There's just a tremendous number of things that physicians and other healthcare providers are expected to do. And then people go, well, it's really kind of, I don't understand why they're burning out. They're burning out because their time is being eaten alive and they're not able to maintain a work-life balance. They have to sacrifice a lot of their free time with their families, a lot of rest time in order to be able to keep up. We need to work very hard to make sure that healthcare providers are taken care of better. And AI may help. There's some hope that by putting some of these things into artificial intelligence and letting them help might be a good solution, but we haven't really fixed that, and we're not really sure yet.
I agree with you on that. I don't think, as I said, people are not thinking about it. How it is that we can make the load a bit lighter, because it's time for us to start working, smarter, not necessarily just harder, but smarter. And if it is that they are implementing these things, like to redo some course or something to maintain, your certification, how about also implementing new things if it is that's the case? Teaching new things with AI, because that's where the world is going now, or something else. Because if it is that it's the same, we're doing the same training over and over again every year to maintain the same credibility. Is our credibility really good enough? Because we're doing the same things without learning, and every year something changes. Things don't stay the same. So if it is that things also can be implemented that's new, fine. But if it is that we're going to be doing the same thing over and over again, does it really make sense?
I completely agree. Jade, let me put this in some perspective for you, because this is easy to understand. When primary care doctors see patients in their office, they're given somewhere between 10 to 15 minutes per patient.
Yes.
Now think about that. Okay. Does that sound reasonable?
It's
That
not.
Yeah. So you see a patient once a year or twice a year, and they come in and you have 10 minutes to sort through every medical problem that they have and every medication and every test result. You have 10 minutes? Seriously? I
Yeah.
mean, in what universe does that make any frigging sense whatsoever? And yet, if you don't do that, then you're punished because you haven't seen enough patients. Your salary is dependent on how many patients you see and how many work units you carry out. So you really have no choice. So what do? You hurry through the visit. You don't pay attention to every little thing that you need to. You certainly don't talk to the patient. You're lucky if you have a time to put the stethoscope on their chest. That would be great. And then remember, that also includes record keeping, right? You need to write a note or put an entry in the electronic medical record in 10 frigging minutes? I mean, come on. Are you serious? And yet that is the standard of care. That is the way people are expected to carry on. I mean, how can that possibly be? And how long can we do this? The medical visit time is, I think, the root cause of a lot of the problems we have with physician burnout, with patient satisfaction, with quality of care, with malpractice. I mean, you're going to miss something in that period of time, and you miss something and you're liable for it. I mean,
Yes.
it's just not reasonable.
And then it falls back on your shoulders, because
Of course.
if it is that patients are complaining that they're not getting the best treatment or the best help because the 10 to 15 minutes is not good enough to speak about whatever ailment has been happening and the medications that have been on all year, and if it has been helping, if it has not been helping, and what are the symptoms I'm going through or not, you're not able to sit and to speak about all these issues with the patient. And therefore you may say, okay, you may need to take this when this is not particularly the case that you need, but because you don't have any time and you don't have the time to sit and go through everything. There are times when doctors may have just suggested things because this is what they're thinking is happening, but they haven't got the whole picture of the symptom or the symptoms that the patient is having. And therefore, it falls back on the doctor's shoulders, because now the doctor is liable because you gave the patient something that they shouldn't have gotten because 10 minutes was not enough for you to hear what was being said.
You said it more eloquently than I did. It is the root cause of many, many problems in medicine. And the reason there is this 10 or 15 minutes is because we're not paying doctors enough per visit. So if the visit cost or the visit fee is low, then the healthcare system that owns the doctor is going to go to the doctor and say, okay, if you want to try to generate your salary, whatever that is, you're going to need to see 30 patients today. 30 patients. You have 10 hours in the office or 8 hours in the office. You have to see 30 patients. Well, do the math. It's 15 minutes a patient and no time in between, no time to do record keeping. When I was seeing patients in the office, I used to eat lunch while I was punching in things into the computer because I didn't have time to stop and have lunch. All right. It is insane what we put patients and doctors through in the name of profit. And that's what this is all about. It's all about making money.
And then many times you have some of the doctors leaving because they can't deal with the kind of burnout or stress. So you have limited doctors, and now with limited doctors in whichever healthier facility that you have, then you have the amount of clients that are coming in because now they have to take on other doctors' patients. It's a lot. It's a lot to manage. And I can imagine, because every time I go to see my PCP, he's always in a rush too. We have had times where I've had to advocate for myself to say, hey, we're not gonna do this because this is what I'm having, this is what I'm feeling, not this. And the good part is that my PCP and I, we have a good repertoire in terms of our relationship. So I would, say such and such or whatever, and he will listen, even though he's not a lot of time and he's rushing. But I ensure that, okay, I know that he doesn't have all this time. So I go in with all the information and give it to him one time. It's not enough sometimes because it can be overwhelming both for the patient and for the doctor. But we just have to do what we have to do because this is the time that we get. right? So I can
Yep.
imagine how difficult it is for you and how difficult it is for patients going in, because they don't sometimes want to talk to their doctors about things and are not able to do so because they don't have enough time. So that's something also that needs to be fixed in the system in terms of that patients need the time and the doctors need the time also with their patients.
I couldn't agree with you more. And this is another place, by the way, where the EMR throws a wedge between the doctor and the patient, because the doctor walks into the room. I'm sure you've had this experience, and walks over to the computer and starts clacking at the computer,
Yes.
not even looking at the patient, not even talking to the patient, but worrying about what they're entering or looking at the stuff in the computer rather than having any kind of personal contact. I mean,
Yes.
it happens. It happens all the time. It happens ubiquitously in medicine, and unfortunately, it hasn't changed, and it hasn't changed because we continue to focus on the issue that we've said several times, which is how much money can we generate? How much money can be generated in this medical adventure that we have? And so what a doctor will do, if you do penetrate their sensorium and you say to them, I have a problem, what the doctor is likely to do is say, okay, then we're going to order a test. Rather than we're going to order a test. I've had patients tell me that the doctor never talked to me, never touched me, never examined me. But then I walked out of that office with 5 slips of tests that I had to have. That's the way you compensate. When you don't have the time to really think and to examine and to process, you start ordering tests because you think that's going to cover your butt. But it's not a really good way to practice medicine. It's terrible.
It's a bad way, but sometimes I hate to say it. I really do hate to say it, but sometimes there's no choice. Sometimes there's no choice in what is happening, and it's sad both for the professional and it's sad for the client coming in. It's sad on both sides. And yeah, this is something that really is gonna have to change. I don't know if it's going to, but it's something that's going to have to, in terms, if we want a better society, it all starts with our health. And if our health is not being paid attention to because of monetary compensations or how the money that's brought in is more important than our health as a society, then we're really in deep trouble.
Yep. Well, I think we are. As I said, I think there's solutions, but they're not going to be easy.
The last one that we're going to look at is story 18. Those big centers love to tell you just how great we are.
Well, that one gets into one of the issues that a lot of patients talk to me about and bring up, and that is medical advertising. We are barraged with advertisements from so many different areas of medicine, including drug companies, device companies, and then of course healthcare systems telling you, really how terrific they are in taking care of patients. And one of the things that the book asked, the question that I asked in the book is, how much money are we spending on this medical advertising and what good is it? So if you have a heart attack, okay, you're in the middle of the night and you are having a heart attack, are you going to tell the people who come in the ambulance that I saw a commercial for this hospital over here? And I know you could take me to the closest place, but I really want to go across the bridge
Oh my
because
goodness.
they said they're the best. They said
Right.
they're the very best, and I want to go there. I mean, it's absurd. What medical care people need and want is usually urgent, and they don't really have a whole lot of choice. And even if they did have choice, it's really difficult for them to discern which really is the best institution, because all of them say they're the best. I mean, if you listen to the commercials, they're all number one in this or number one in that or whatever. Well,
Mhm.
how much money are we spending on this nonsense? And if we took that money and we hired more nurses to staff the floors where you were in the hospital, how much better could your care be? I mean, if you actually had somebody who answered a call bell or gave you a bath or sat down and actually held your hand and asked you questions about and tried to deal with some of the emotional responses that people have in the hospital, how much better off will we be than putting these frigging commercials on television and making everybody think that you're the best? In reality, to be honest, there's really very little to tell among these systems. Yeah, There may be some systems that are really, really good and some systems that are really, really bad, but there's a gigantic number of systems that are sort of in the middle ground. And there's no advantage to telling people what to do when they get sick. It's really more a question of them feeling comfortable. And the other thing is, and Jade, you mentioned you have a really good relationship with your primary care doctor. If you had a really severe, a significant illness, wouldn't you ask that primary care doctor where you should go for your care? Isn't that the most important element? It isn't what you see on television. It's what your primary care doctor says. No, Jade, you need to go to here in order to get care with this person and at this hospital. And you would believe it. And you would probably be well off doing that.
Yeah. Yeah, you're right. And it's because I do have that kind of relationship. Not many other persons have that. As we said earlier, because they don't even have the time to build that relationship with their PCPs. I'm adamant about that because my health is important to me. So I made sure that that's done. And he's very personable also. So, there's no time, but you're just go in and get what needs to be done. But not everybody has that. And not everybody able to build that because some doctors, they're so burnt out also that they're not personable.
The other thing that happens is you have a really good doctor, and that doctor begins to burn out because they're, overwhelmed. And then they go into some kind of a concierge practice. I'm sure you know about those, where people have to pay $2,000, $3,000, $4,000, $5,000 extra per year in order to have access to their doctors. And the book talks about, there's a story about concierge medicine in the book where a really nice couple had a tremendous relationship with their doctor who then went concierge and they couldn't afford it. And they ended up not really having a very difficult time finding somebody to take care of, never being able to establish the same relationship. So that's one of the things that has really eroded primary care. Not only are people leaving primary care, but they're also transitioning into this concierge model that a lot of people, especially in lower socioeconomic situations, simply can't afford. It's too expensive.
It's too expensive, way too expensive. It's I don't know. I don't know what can be done. And as I said, the solutions are there. It's if they're going to implement them.
Jade, the good news is it can be fixed. And I know it can be fixed because we're spending $5 trillion a year on healthcare in the United States. Think about that. That's $3,000 for every adult person in the United States per year. And we're not getting our money's worth. If we were reallocating this money to put it where it really needed to be to take care of the people that we need to take care of, we can solve this problem. We're spending plenty of money. The problem is it's going into all the wrong pockets. It's not that we don't have the resources. That's the frustrating part of this is we have tremendous resources. We have tremendous science. We have all these breakthroughs in medicine. And yet the rank and file of people, especially in the lower socioeconomic conditions, are not able to access it and not able to get the kind of care that they need. And that's the frustrating part of all this.
Yeah. The only thing we have to do is hope and pray for the best because I don't know where it's going to go in the future. And I'm hoping that it gets better, not worse. But that's all we can do right now. We hope. And we hope that systems change and people decide that, people are more important than money or people are more important than everything. All these things that we're trying to do, including the big sectors and all these noises that is being made about, the technologies, etc. Because if these things are not useful for us, if it is that it causes us harm, that's such a truth.
Yeah,
That's just where we're at.
Very frustrating part of this is that people who go into the healthcare professions really do want to take care of people. I mean, so one of the things that's been very poignant here in the Philadelphia area is that we've had a number of nursing strikes, and the nurses are going out on the picket lines, and they're going out. They're horribly underpaid. We underpay nurses. It's just abysmal what we pay nurses. But that's not why they're on the picket line. They're on the picket line because they are worried about their patients. They're worried about the patient's safety and because they don't have adequate staffing. They don't have enough nurses on the floors that take care of patients, and they're worried that patients are going to be hurt. So the good news here is that there are a number of people in the healthcare professions who really do give a damn about their patients. The problem is that we're not letting them do the things that they need to do. And it's very frustrating to watch this. I still remain somewhat optimistic that things will get fixed, but it's going to require a good deal of work and imagination. It's also going to require patients and healthcare providers to unite together to petition because they're not listening to us. They're not listening to the healthcare providers. Maybe together we can get people's attention.
Yes, maybe together we can do so. Yeah. This is a hard topic to listen to speak about, to digest, because it's affecting us. It's affecting everyone, regardless of whether they want to speak or not. Our majority of the persons, it is affecting them. And we are not really seeing anything being done about it. So this is a good time for us to, as we're doing now, start having the conversations more about it in the media, on social media, the platforms, so that we can start educating people, so that people can now say, okay, we need to advocate more for ourselves and for the community, for the society, in terms of better healthcare for ourselves and generally the community. It's something that we can advocate for. So thank you so much for even bringing this topic to light. And thank you for the book that you have written that is going to reach many. It's going to be hard. It's hard to read. But once people read it, they see the magnitude of devastation that is really taking place in our society. And sometimes we're not privy to the information. So this book is bringing to light also some of these problems that we're facing, or these challenges that we're facing. Want to know though, Dr. Noe, where is it that we can purchase the book? Where can we contact you, find you if we want more information?
It's very simple. Peter Kowey, Peterkowey at peterkoweyauthor.com. So it's peterkowey author.com. It's my website. If you want to just buy the book, it's available on all the usual outlets like Amazon, etc. But if you want to learn more about not just the book, but the topics I've done really dozens and dozens of interviews and podcasts. A lot of those are links on my website. If you want to learn more about the issue, that's the best way to do it. The website.
Awesome. Thank you so much again, Dr. Noe, for sharing with us in terms of all these things that are happening and bringing it to light. Sometimes some of us don't know the depth of or the magnitude of what's happening. Dr. Kowey really brought that to the forefront. So I'm hoping that people hear, people learn, and people advocate for themselves and even others in terms of how this is affecting us all. So thank you so much for sharing that.
Yeah, I very deeply appreciate the opportunity. What you said a minute ago, I very much believe, which is the first step is the conversation, to bring it to light, people to talk about it, and then we can begin to think about ways that we can fashion change in order to improve care. So I very much appreciate your willingness to talk about the topic. Thank you, Jay.
No problem. So I want to say thank you so much again. And I want to say thank you so much to my listeners for continuing to listen to The Unfiltered by Jade. And we'll be back next week, Tuesday. Thank you. Bam, 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 bam,